Oftentimes, morning foot pain is related to something called plantar fasciitis. Plantar fasciitis is inflammation of the ligament that runs from your knuckle bones to your heel bone. And as you rest overnight, the ligament becomes contracted. You stand on it in the morning and you develop the soreness or the stiffness that's associated with that. It's called plantar fasciitis. Inflammation of the plantar fascia often occurs at the insertion site of the fascia on the heel bone. And that's why it's so tender right there on the medial aspect of that heel or on the inside aspect of that heel. You should certainly seek treatment from a podiatrist if this type of pain, morning pain, goes unchecked for a period of time. The sooner you get in, the sooner we can treat this, the faster you'll be able to get over it. Longer we maintain symptoms of plantar fasciitis, the greater the chance of other parts of the foot starting to hurt. It's called lateral compensatory syndrome. As we have pain in the arch, other parts of the foot become painful. And then we have to do more, such as orthotics or injections or anti-inflammatories to relieve the symptoms. With morning foot pain, it's important to follow up with your podiatrist as soon as possible.